We need to consider a C-section.
A C-section?
That's a little bit of an unprofessional situation. I agree, this is ridiculous.
Breathe.
Oh god, it's like alien. Oh! We're gonna react to another birth scene in a medical drama. Up today, Chicago Med. Also, make sure you tag Dr. Mike, because we gotta get on this podcast. Okay, we've got a doctor with a cute little pregnancy buff. Oh. Oh no.
Dr. Manning?
Dr. Manning?
You okay?
No.
Oh.
I think my water just broke.
Oh, jeez.
Oh my god, it did.
Oh!
I guess this is happening today.
Mech. Her water broke. You see how that is not clear or yellowish clear fluid? Meconium. That means baby has pooped inside, and there's now meconium poop inside that amniotic fluid. So this is something that when this happens, we often monitor you a little bit closer to make sure baby is coping well with everything that's happening with labor. Also, I would like to know why this is like all over the floor and not all over her pants. I'm telling you, if your water broke in pants, your pants will be soaking wet before the floor is soaking wet. But we got meconium stained amniotic fluid, so I'm assuming that the next scene is going to be her attached to a fetal heart monitor, making sure that baby is doing well. So let's see.
Go get Dr. Charles.
Oh, she's like, I can't. She's like, I'm all done.
I have to go have this baby now.
He'll help you. She has to go have this baby now. Okay. So we're gonna now obviously hook her up to the fetal monitor. So okay, you got it, girlfriend. Crush it. Also, let's ring for somebody to clean up the floor because someone's gonna break an ankle for sure.
Breathe out, exhale.
Nope, no. We're just we're doing some laps here. No fetal monitor. Now we're doing laps. And I don't know who this lady is, but she has a very, very lovely face. So let's find out who this lady is. Yeah. Good job. Her socks are really cute. Also, this girl scrubbed.
How much longer do we have to do this?
10 more laps. Make sure everything gets lined correctly down there.
So babies tend to come out quicker if you've already had a baby. So I don't know what baby this is for her. If it's her first baby and her water just broke, you know what? Not everybody goes into labor. Most people will go into labor within 24 hours, with the big majority of people going into labor within 48 hours of their water breaking. But she just cracked that water on out of her. So I think she definitely has some laps to go still.
You know, I am seriously regretting making you my birthing coach.
Oh, she's a birthing coach. Okay.
That means I'm doing my job.
Sorry, I had to bribe Fromson to cover my shift. What do you need me to do?
Okay, I need you to walk with her for now and be her rock.
We love a supportive birth partner for sure. A supportive birth partner is one of the things that can go the farthest towards a positive birth experience. So there are lots of things that your support person can do. I'll link a video up top for you. Lots and lots of things. Go to that video and then send that to your birth partner so that they have all the tips.
I'm here for the duration.
All right, she's in it to win it. Perfect.
I'll get you some ice chips.
Ice chips. Okay, so the thought process behind people who are in labor having only ice chips or having only clear fluids. Here's the thought process. I want you to know the information for the protocols around eating and drinking in labor. They're sort of based on like in the 1960s or so. I do have a video all about it up here with more information. But the thought process is, if you do not have a stomach full of food and you are in labor, and if you happen to go from a vaginal birth into needing an emergency C-section, and then during that emergency C-section, you happen to need to go from a spinal, where you were awake, to a general anesthetic, where you are put to sleep, and then you happened, during that general anesthetic, to vomit, and the food in your stomach came up and went into your lungs, then there is a risk of something called aspiration pneumonia, and there is a small chance of death. But do you see how that's like a really, really long path of ifs, okay? So I want you to watch the video if you haven't already up top about eating and drinking in labor, and then really, really think to yourself if eating and drinking in labor is important to you, and then make some decisions with your care team from there. But he's gonna go get her some ice chips, because, you know, ice chips are the way to roll. The hospital ice is really good, though. It's like small and crunchy. All right. So things have very much picked up. Looks like she's pushing her baby out. So she's fully dilated, pushing her baby out. Pause, go back. Go back. Look at this belly. She is next to a fetal monitor, which appears to be tracing with, late decelerations, meaning she's having baby's heart rate is dropping after the contraction, but not a fetal heart rate monitor in sight. Nothing on this beautiful prosthetic belly. We're just sort of, it's like wirelessly transmitting from her body into the fetal heart monitor. Okay. Pushing baby out, lithotomy position. Okay, looks like her heart rate is starting to get elevated. What was her? Oh, her blood pressure 140 on 90. We could be creeping into preeclampsia area.
Your BP is rising.
BP is rising, yeah.
It's still okay, right?
The baby's not descending. I'm worried he's occiput posterior and stuck in the birth canal.
What does that mean?
Okay,
The baby is sunny
that was
side
a
up.
lot of words, okay? Occiput posterior. So she is worried that the baby is facing the wrong direction. Still head down, but instead of basically facing the floor, baby would be facing the ceiling. And that makes it so that baby's back is riding along mom's back. This can cause a ton of back pain in labor, but also now, instead of the smaller part of baby's head coming through when baby has their chin flexed, and it's just the back part that's coming through, now you have a wider part because baby can't flex their chin. They come through kind of deflex like this, and the wider part of your baby's head is going to try to come through. So you can have a baby in an occiput posterior position. It's very possible. A lot of times it ends up being a longer labor and a harder labor because you're trying to push a bigger part of baby's head through the same opening that could have been smaller if baby was in an optimal position facing the right way with their chin flexed. So she's saying that the baby is not really coming down, the baby's in the wrong position, and they're a little bit concerned, okay?
It's still okay, right?
First of all, I would have
baby's
been
not
concerned a long
descending.
time
I'm
ago
worried
because
he's
of late
occiput posterior and
decelerations,
stuck
but
in the
now
birth
we're
canal.
concerned because
What does
baby
that
is
mean?
sunny side up.
The baby
Okay.
is sunny side up.
Breathe.
We need to consider a C-section.
C-section.
The woman was too stunned to speak.
There are a lot of things happening here that may or may not be necessary.
Is it that serious? Is the baby in danger?
Ma'am, I'm sorry,
Ma'am.
but I think it would be better if you waited outside.
No,
Come
I'm
on,
not
ma'am.
leaving.
It's okay. I'm fine.
Okay, so
I
now we
promise.
have an obstetrician who's telling her that this is not going well and she needs to have a C-section or consider a C-section. We have this beautiful lady here. I don't know if she's a registered nurse, a birth coach,
right
a
outside.
midwife. Let me see. Okay.
I don't want to
Doesn't want a
C-section.
C-section.
I don't
Most
blame
I
people
think you're
don't
being
end up
overly
wanting a
cautious. Is that
C-section.
because
So
you're
let's
treating
see.
another doctor?
I treat all my patients the same.
We're not there yet.
Are you questioning my judgment?
I'm her midwife, and I don't think cutting into her is a good idea yet.
Whoa. That's a little bit of an unprofessional situation. Makes me feel awkward.
I'm her midwife, and I don't think
She's
cutting
her
into her is
midwife.
a good
Okay,
idea
that
yet.
makes a lot more sense now. So this is a little bit tricky because you have sort of two hierarchies of power that are trying to figure out the best plan of care for the patient. So we definitely need to get some patient input here.
Are you going to listen to her or your obstetrician?
Nat, I can turn the baby.
Turn the baby.
Natalie?
Oh,
Nat.
dear. This
Let her try.
This is not really an example of informed consent. This is a little bit of pressure on somebody who's in a very vulnerable state, being fully dilated, pushing a baby out, being worried about their baby and not knowing what to do, and having two people that she has put her trust in sort of trying to fight over her. So this is a little bit weirdo. Also, when you have a baby who's facing the wrong way, it is possible to turn the baby while you're pushing. So the best thing you can do if your baby is OP is try to get baby in the best position before they descend into the pelvis. Doing things like all fours position would be a really, really good example. But apparently she's going to try to turn this baby. I'm not sure why the obstetrician isn't trying to do that. And she's like, I'll do it. Let's see what happens. Okay.
Let her try.
Oh, dear. Okay, also, this is going to be really uncomfortable without any pain control on board. She's gowned up.
Breathe.
Oh! Pause. Okay, so now we're not talking about turning the baby from an OP position to an OA position. This is called an ECV. What she's doing right now with her hands on the outside of this person's belly, she's doing an ECV, or an external cephalic version. This is something that we do for a baby who's in a breech position, or feet or bum down, to try to turn the baby. And it's definitely not something that we would be doing while the patient is fully dilated in active labor, trying to push the baby out. This is something that is done at like 37 weeks of pregnancy. Also, this baby is head down, so I'm not sure why we're now trying to turn the baby. Oh, God. Okay.
Give me ultrasound.
Heart rate's decelerating.
Heart rate's decelerating. Heart rate's decelerating. There's no fetal heart rate monitors on her belly because they're doing an ECV and they're doing ultrasound. There's no fetal heart rate monitors on her belly. But don't worry, we're watching the heart rate and it's decelerating. I'm not surprised because they're doing an ECV on a baby who is not bum or feet down. It is head down.
Baby's still OP. We should operate.
Not yet.
Okay, so she wants to go to a C-section.
time,
She's like,
okay,
this
now?
is ridiculous. I agree, this is ridiculous. What are we gonna do? Oh, we're gonna try again.
Breathe.
Oh God, it's like alien. Oh,
Try it now.
I don't know what that clicking noise was.
Yes. Okay.
You did it! Baby is no longer OP. It is now breech. But in this situation, now the baby is facing the right direction. We can just push this baby out. They are no longer spine to spine. They are now turned the opposite way. Let's push this baby out. Team is standing by at the warmer, which is good because we have a Meconium baby with decelerations in their heart rate and just went through an ECV unnecessarily.
That's
Go.
it.
Hard.
Push.
Yes.
Wait a second. Again. 3.
Good. I like that they waited for a contraction. That was good. Go.
That's it.
Babies.
Okay. That's it. Carry it.
Stop it. Go back. 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 Did they just... Go again. Go.
Okay. That's it. Carry it.
After all of that nonsense, the baby just came out in an OP position. They turned the baby using an ECV to get it from an OP to an OA position, and now she pushed that baby out. Do you see where that baby's looking? Up to the sky. That baby is sunny side up, back to back, OP position. Okay, baby is born, all right.
We've got a tight nuchal cord.
Okay, tight nuchal cord. That means a cord around the neck, which is actually a lot more common than you would anticipate. Sometimes it's 1 loop, sometimes it's 2 loops, sometimes it's loose, and the physician or whoever's delivering the baby can just slip it off of baby's neck and carry on with the birth. If it's really, really, really tight, sometimes they will actually clamp it at the neck and release it by cutting it and then deliver the rest of baby. So nuchal cord, it sounds extremely scary, and it can be for some situations, but a lot of times this is more common than you might know. So nuchal cord, okay?
Baby's not breathing.
Oh no. Oh.
Clamp.
What's happening?
Okay, so baby's not breathing, so they are going to clamp and cut the cord right away, which is very, very protocol where everybody works. The delayed cord clamping for a baby is really, really good. However, if they are in need of medical intervention and resuscitation, we clamp the cord right away and take them over to the warmer where there's a team of experts that can help you with transition. Okay, so we're clamping the cord, we're bringing baby over.
Tell me what's happening.
We definitely should be telling her what's happening.
Someone tell me what's happening.
Meconium in the airway.
Okay, so meconium in the airway, which doesn't surprise me because we did see that there was meconium in the fluid. I appreciate that they put the baby in the warmer the right way with the head towards the person at the top, which is likely a respiratory therapist, so that's good. And now we're going to help baby.
Suctioning now.
Oh, and the obstetrician is going to break sterility by touching everybody with her sterile gloves. So those gloves are no longer sterile.
They're working on the baby.
Okay, they're working on baby. Okay, we're going to keep mom updated. At this point, we should also, though, be turning our attention back to mom and making sure mom is doing well, because now we're going to be looking at things like bleeding and tears, and we're also going to be watching for that placenta to separate and birth. But for the purposes here, we are concerned about baby, and this is definitely something we need to pay attention to. Okay, working on baby, drying, stimulating, I like that. Okay, looks like they're intubating baby. Pause. So they had a laryngoscope, which we used to intubate. However, then they picked up a mask to ventilate baby. Not sure why they had the laryngoscope in there. That's okay. That's very good that we're ventilating baby. A lot of times babies just need some help with their airway. Oh, there's that sterility again. Come on, baby. Come on. Okay. Breaths. Good. Inflate those lungs. Come on. Yes. Oh. Okay. As much as I love that the baby is now crying, suddenly this baby just transformed into like a 3 or 4 month old baby. Looks great though. Pink baby, very responsive, good tone. This baby looks amazing. Looks a lot better than that doll baby, but yeah, I wish that there was a little bit more consistency on the ages of babies in TV shows. I believe that there is something to do with like labor laws and how long babies can be on set and how old they have to actually be on film. But like, it always blows my mind when suddenly they're like, here's your 4-month-old newborn. I love a baby cry, though, especially after a silence. Oh. We're still not worried about mom's placenta or bleeding, but love this. Oh, look at that baby's head.
Here's your son.
Oh. I do have to say, like, no matter how many births I'm involved in, I still think it's unreal. Like, sometimes I'll still get so caught up in the moment that I'm still, like, watching it happen and thinking to myself, how is this a thing? Like, this is unreal. Like, how this was just inside of you. You did the damn thing, and now here's you with your baby. Like, now you're a mom. It makes me emotional. I'm so glad this baby did well. Okay. I would say on a scale of 0 to 10 on medical accuracy, I'm going to give them a 4.5 out of 10. Maybe they need even less than a 4.5, maybe a 3, because then we got to think about things like meconium in the fluid, but they didn't put her on a monitor. First of all, then there were no monitors, second of all, on her belly at all, even though they had her on a fetal heart rate monitor. We sort of abandoned mom's health when the baby came out so we could focus on the baby. Yeah. 3.5. I'm going to go right in the middle. 3.5 out of 10. Chicago Med, if you need somebody to do your advising on your birth scenes, I am definitely available for you. But this one is nice because I had a happy ending. It gave me the feels at the very end, and that's really, I mean, in a medical show, that's all we're looking for. We're just thankful that wasn't an actual situation. So let me know if you like me going through them, but more importantly, let me know what absolutely wild and bonkers birth scenes in a TV show or a movie you want me to go ahead and go over. If you like this one, go ahead and click subscribe, give it a thumbs up. Check out this video for even more fun information and fun shenanigans. I will see you in the next one.